Welcome to Morning Infusion with Dr. V, where we are intentional about connecting you with leaders that have overcome so that you know that the possibilities are endless. It's Dr. V here, where our coaching program teaches nurses to work from their computers anywhere around the world, making money and owning their own time. Our featured guest today is Shima Andrews. Shima is a board certified family nurse practitioner. She obtained her master's in nursing from Sacred Health University in Fairfield, Connecticut. She has over 12 years of experience that includes management of chronic pain conditions, trigger point therapy, women's health, infectious diseases affecting public health, stem cell therapy for pain management. Interesting. Medical weight loss, sexual dysfunction, hair loss, intravenous vitamin therapies, and so much more. Shima continues to give back by mentoring nursing students, both at the undergraduate and the graduate level in the clinical setting with University of Connecticut and her alma mater, Sacred Heart. She currently runs a consulting company that seeks to empower nurses on maximizing their career path. So welcome, welcome, welcome. Thank
Thank
you for
you.
being
Thank you.
here.
Happy to be here.
So now you were a teenage mother. We're going to start out with this. You were a teenage mother because, the root determines the fruit, right? So
Yes.
understanding where you come from. So you were a teenage mother.
Yes.
What were some of the things that you went through your mind when you first got pregnant?
How I'm going to tell my mom. I'm like, how I'm going to get through this. Because, it was literally just me. And her father did not want to be proactively involved. So just the thought of realizing that I'm gonna have to do it somewhat alone was just overwhelming and scary. But I was like, I'm gonna have to put my big girl panties up, and I'm gonna have to take all the shame, so to speak, and I'm just gonna have to deal with it. And now, interestingly enough, it was my driver and my motivation, because now I was no longer responsible for myself.
That's right.
So I know I had to finish. I graduated high school pregnant, actually, and nobody knew until way later. But yeah, it allowed me to grow up even more and to realize that there was another purpose that I could not afford to just slack off. So
now, when you told your mother, how did that conversation go?
it was painful, because I think most of my family members didn't know that I was actually sexually active at that time. So, and coming from a strong West Indian cultural family, it's just, you're either told, don't be doing that, but it's never an open dialogue about if you end up doing this, this is how you can, protect yourself from certain things, whether it's STDs or pregnancies. It's almost like a shameful conversation until you become an adult, an adult per se. So it didn't go well. There was a lot of tears, and it was like, well, you're going to have to just deal with it and do what you have to do, and whatever I can do to help, it will be like that. But it's pretty much your responsibility to get going. But the support system was there after I had her, in terms of helping me with the things I didn't know, how to bathe her, how to hold her right, all of those different things, the staying up at night. I had support with that, which is I'm super thankful for. So yeah, we got through one step at a time, despite the rough beginnings of people feeling so disappointed, that this was not the time for that.
I think that, it's important to have that representation, especially when as it relates to getting pregnant as a teenager.
Yes.
Because what happens is a lot of people think that they can't do it, right? They think, you walked across the stage pregnant, right?
Yep.
And you are now, you got so many letters behind your name that I could not even fit them on that little tag up there, right?
Yes.
You have got it. You have, and you're a nurse practitioner, you have your master's.
Yes.
It's important for people to understand representation is everything. So thank you for not giving up. So
100%. Yep.
So now you came here from Jamaica. Was it always your desire to come here? Why was it so important to come to America?
So my parents, my dad migrated to Canada, my mom migrated to America, and then it was just me and my little sister, and she migrated before me, so I was the only one that was left. And so I was like, okay, I don't want to be the only one to be left behind. Like, you kind of go through, like, even though you're told it's for a better opportunity, yes, your parents go away so that they can have a better opportunity to, like, send you through school, take care of you as you're growing up, something that they may not have been able to do while they were here, like physically there still. It was still hard. It was still hard because then I ended up living with my grandmother, and she's a lot stricter with certain things, and the childhood was a little bit different. But I just know that I didn't want to be the only one that was left here. And so, like, in terms of like petitioning and how rules are, like, if you have a spouse that's married to somebody who's filing for, he can petition for the children as his stepchildren. And so that's kind of the route that I took to get here. Since I was young, I was not thinking about marriage or looking, to meet other people in that spectrum. I didn't have that exposure to them from the little community that I was from in Kingston. So yeah, it was important to me that I was able to get there, to get exposed to the same opportunities, to be for a better life. Because pretty much my situation, if I stayed, I would not even have been able to afford like community college, much less regular university. And parents didn't have it. So I would have needed to just leave high school and go straight to work, which I did for a couple months while waiting for, my paperwork and stuff to come through. So.
Gotcha. I love it. I love it. I love it. So now you wanted to open a wellness center. Well, hold on. Let me ask this question first. You began as a nursing assistant. Now, what were some of the motivating factors for you to go back to school? Because once you got over here, you became a CNA, and then you went back to school to get your RN degree. So what were some of the motivating factors there?
I always wanted to do medicine. I just knew I could not afford it in the Caribbean. There's no way. Like, the tuition would be in the millions of dollars if you were to compute the equivalent right now. And so I was like, all right, well, maybe I can start at the bottom and work my way up to a nurse. I didn't even know that I could just go straight to nursing school. I was like, all right, I'm going to get exposure by, going in, and I'm going to I was a home health aide first. And then I became a CNA afterwards. So I met my now husband, who I told him what I wanted to do. And, I have my daughter, and I have to take care of her. And I wanted a career that was stable. And healthcare seemed to offer me that. So he was the one who actually paid for me to go to nursing assistant school and was my patient for like my exam. Yeah. And then just kept encouraging me to keep going forward. That I even applied for like the LPN program with the state of New York to try and get like the free tuition, and I missed it by a few points. And then I was like, all right, well, I don't even know what's next. So I enrolled in community college, and I met this wonderful psychology professor who was like, look, go to private school. You can go straight to the RN. Yes, you missed that opportunity, but it doesn't mean that you have to wait a whole year again. You can move to that fact, and get going in your career, which was very good to have somebody who knew what it was all about. Because my mom was also a nursing assistant, but in terms of like getting everything done, new to a country, I had to hop on the train, figure out my life, missed my stops, got in wrong directions a couple times, but get over that overwhelming feeling and still push forward that, yes, this is the goal I have to attain, and it's no longer just about me anymore. So I have to make it happen. And that's the mentality I have today. It's never just about me. Like, now I have 2 other kids that I have to take care of, and that I have to be responsible for. So my drive is different. Like, my drive to succeed is much more different, because I'm responsible for these little beings that are also counting on me. So that's kind of like my view of stuff.
I think that you said a couple of things that was very important. So one of the things that you said was your environment. So, you started dating this guy who was willing to pay for school, right? And so he provided a type of environment for you. Yes. That was, a growth environment.
Yes.
And this is the value of vetting. Like, I didn't get it, right? I didn't get it when I was a young person. I didn't get that the vetting process, when it comes to, having your husband, is the most important process. You got to vet the person right, right? Because if you don't vet the person right, you can end up, in a hot mess, right?
Yeah.
And then you said that it was, the importance of your drive was outside of you, right? Because at the end of the day, if you're just doing it for yourself, you will never, because you will let yourself down,
Yeah,
right? But
yes,
you're not going to let them children down.
yes.
You're not going to
They
let
gotta
them.
eat, and they didn't. And my grandma would always say they didn't ask to be here,
That's exactly right.
right?
That's
So
exactly right. I
yeah,
love, I
so that
love.
took
So now
that responsibility serious. Yes.
you wanted to open a wellness center. Now, why was this so important for you?
So, working in healthcare for, since 2008, I became an RN. But even just as in a smaller capacity, home health aide and CNA, just working in that, you kind of see this trajectory where the clients they'd go to their physician's office, they'd have these chronic conditions, they'd take this whole bunch of pills to manage the symptoms, but there was no, how can I help you reverse some of this dynamic if you're motivated, or how can I help you get motivated to reverse some of that dynamic? How can, if you're not at the place where you're ready to change, how can I help it where I can slow your disease progression, or I can prevent side effects from some of those medications from causing other issues, right? So you're gonna take the statin for your cholesterol, but then on the next end, I'm gonna deplete your CoQ10, and that's so important for like your cells, right? We need that to function. So I realized the system was driven by a lot of rules in terms of like payments, and then revenues, and it was the patients that were left
Suffering.
with the short end of the stick. And I
Mhm.
wanted to be in an environment where I had some kind of control over that. So for the patients who wanted more, or for the patients who conventional medicine say, I could no longer do anything for you, I would be in a position to offer them other options, whether it be complementary, integrative approach, or, just complete like, no, it doesn't mean that this is the end. Here are other options for you. You can still continue on your wellness journey. Even though your insurance would rather you get diabetes than reverse the pre-diabetes, they'll pay for the meds for the diabetes, but they won't pay for the obesity drugs to help you lose the weight, right? So
Wow.
it's the two sides to the coin. So that's why that was important to me. I needed to know that the system wasn't just broken, and it was just a period, and it was just full stop there, that I had some kind of control in terms of how I could offer my clients additional options.
I love, love, love that, because I always say that, first we have to work proactively, but we have to
Absolutely.
understand that, we are working in sick care. And the reality is that as when we go into nursing school, we're taught disease processes. That's what
Yes.
we're taught.
Yes.
We're taught that, right? There's
Yeah.
not a whole lot of health and wellness stuff that
Nope.
is taught within nursing school, right? Because,
Yeah.
you're so busy trying to learn the the sick side of things that that proactive side of things is not something that we typically learn, and that's
No, and
probably
then you screen for disease processes. So when
right.
you go for your annual physical, it's a screening. I'm going to screen to make sure you don't have XYZ, but it's not like, and then I'm going to tell you, oh, you need to lose some weight, but I'm not going to give you the resources. I'm not going to sit down with you and to say, all right, look, your numbers, this is what your numbers mean. This is how you can change. This is what it's telling me based on your diet that you're eating, or what you do when you're at home, right? I cannot tell you how many times I sit down to go over labs with my clients, and my lab visits are 30 to 45 minutes. I book them
Mm,
because they need to understand what their choices, how their choices are reflecting in those values, and what they mean, and how they can then change it, right? So when the opportunity to not be like a revolving door and to say, oh, you have to see a patient every 15 minutes, and patients are rushed. Literally, when I did my training, that was how it was. It was so busy that you'd be like, oh, pick your top two problems, and that's all you can talk about today. And then this person may be mentally going through a trigger, and would have been, you never know if they're at suicide risk, because you're only picking their top two problems for that day, and then you're sending them home, and then they're not back for another 8 weeks because the schedule's full. So I have the opportunity to create the environment and the flow that I need so that patients can be and stay well, or get well in transition. And that was important in opening my own practice, is that I had control over that.
man, this is so good. I love this so much because, I I love health and wellness because when I look at just me, period, like
Mhm.
I struggle with taking medications
Mhm.
because I mean of all the side effects, right? I
Mhm.
struggle
Mhm.
with it, yet I'm going in and I'm telling my patients to take it, right?
Yep. Yep.
Because it's the thing that, you know, to me, it's a short term solution. You know, I really feel like that your health and wellness is, you know, on the end of your fork. I firmly believe that. I
Mhm.
firmly believe that, you know, your health and wellness is, you know, and how you conduct your day, like your
Yep.
exercise, you know,
Yep.
things of that nature. And so I love it. So now, what are your thoughts on the health disparities in the US?
Hmm. They exist. They definitely do. I've witnessed it, unfortunately, throughout my careers, where you see patients of like lower socioeconomic status, or the clinic patients, are treated somewhat different from the more affluent clients who are the private practice patients who come in. Um, I've seen where language barriers are an issue because you live here and you don't speak English, you speak only Spanish. And so having to do more work to go get that interpreter machine so that your patient can actually understand,
Understand?
ask you questions, be empowered, not afraid because they're going through the same processes, whether it's illness or a birth or whatever. Um, I've heard certain terms. Matter of fact, just the other day, I was doing a vaccine rotation and they spoke no English at all. And I have a little bit of Spanglish, I called it. And so I wanted to at least tell them side effects, what to expect, what to look out for. Um, and it was two of us, so it was a multiple shot. So one nurse took the other client and I took the other one. And I was like, all right, take care, like I explained what I had to explain. And he turned to me and he said, why are you so nice at the end of the day? He's like, they're here
Wow.
and they don't speak English, they don't learn to speak English, and your demeanor, your approach, this is like the beginning of the day kind of vibe. Like, why are you so nice to these people?
Wow.
Right. Um, and I was really taken aback. And I'm like, not because they don't speak English, it's our duty to do no harm.
That's
And
right.
sometimes that involves not explaining certain things, or not saying to them, like, look, if you go home and you have running a fever after the vaccine, it's okay to take some Tylenol. And this is the amount you want to take so that they don't overdose themselves on it. They only have one liver. That's our responsibility. You
That's
took
right.
that oath when you decided to go into healthcare. So I don't know why not be nice to these people. And it's different terms, right? And so the clients were minorities, the nurse was not. Um, so you see it in different contexts. Sometimes I would like to think people are not aware they're even doing it. Um, but certain things, like even like African American women are highest for dying in childbirth. That's an
That's right.
important issue that still needs work and still needs identification and still needs, all right, how can I prepare based on what I know research has been telling me over time for this person on a different level? How can I reassure their mistrust of the system, right? By making sure they have better outcomes. How can I advocate for them differently, despite the fact that they don't speak, whether they don't speak the language or they don't look like me? Um, so yeah, it's
And
still
it's
a work
huge.
in progress. It's still a work in progress. And I think even as providers in the role, you come up against some of that as well when you go in to see different clients, right? It'll
Hmm.
be like, okay, no, I want Dr. John,
Hmm.
or I want this person. I've actually worked where I've had patients come in and say, I want no Black providers.
Wow.
So this parity is on both ends, as the provider and as the patient, and it's still a work in progress. Like, we still have so much work to do to improve outcomes.
And I think it's important, very important, because you know I've had a provider tell me to give, and I tell the story about this young girl
Hmm.
that the provider wanted me to give her a pregnancy category D drug, and she had just found out she was pregnant.
Hmm.
And I said, well, what we're going to do is, because I had a precept tea that day. And I
Yeah.
said, what we're going to do is we're going to tell him that we don't feel comfortable doing that, right? Because you want to be respectful, right? Yeah, we don't feel comfortable doing that. I said, AKA, we ain't giving it.
Yeah. 100%. Yeah. So we're going to butt heads today.
And so he was like, well, this outweighs this risk. And I knew it just didn't outweigh it, right? I knew it. And so, and that's the value of you knowing and advocating for your patients.
100%.
And I knew that if he went to someone else to get it, he didn't have access to the medicine drawer, right?
Mm-hmm.
And if he went to someone else to get it, then what would have happened is they would have asked him, well, why are you doing that? Right? Why is she not giving it? What is the deal? Right? And so he never went, and this girl never got it. And that's the power of advocating for your patients. Don't
even if it makes you uncomfortable.
Even.
Has to do it. Yeah.
So now you made the jump from a full-time job into business for yourself. I know that was scary, but what has been the blessing in doing this for yourself?
The autonomy. There is nothing like it. Just being able to create the schedule, the type of practice to attract the type of clients that, because I'm a firm believer in that you attract your vibe and your tribe. There are clients out there and patients out there that need us. Mm-hmm. So just to be in that position where I can say, guess what? Here are your options. Maybe you don't need pain meds because that's not your issue, but you do need to sit down with someone and talk about like things that are bothering you, or you need to have your care kind of transition to see somebody who's a mental health provider. There's so many different facets to it. Like when I worked for an employer, when I just became an NP, there'd be a lot of revenue driven services. Like I'd have a client come to me with a pain score of 1 for a trigger point. Why are you in my exam room? You have no pain. So like, or 0 pain. I'm like, no, you can continue physical therapy. This is not necessity. But then it's revenue driven. And so I'd always be butting heads with my boss because it was like, well, they need this, so that we can bill the claim. And I wanted to be able to offer patients way more than just the money. For me, it's way more than the revenue. The revenue is it's the icing on the cake. Yes, I got to pay the light bill and I got to pay my staff and all that stuff. But it's a passion project. It's a desire to be able to give more than we actually receive, to pour into your patients and to let them know that there are providers out there that actually really do care.
Absolutely. Absolutely. Yeah. Absolutely. So now we talked about the services that you offer in the clinic. Now tell us about your monoclonal antibiotic therapy and why is it so important for those who are diagnosed with COVID?
So the monoclonal, literally for the layman people, it means 1, right? So it's 1 antibodies. So when we get exposed to any kind of illness, our body makes antibodies to help us if we're exposed a future date, deal with it, to remember, to fight it, right? So with the monoclonal, they specifically created these drugs to match the SARS-CoV virus, so that if you got exposed, you would already have like a lot of antibodies. Rather than waiting for the disease course to happen, you would cut your process in half. So these antibodies would then go and bind, attached to the actual SARS-CoV virus, preventing it from replicating, preventing it from further invading cells, hereby cutting the disease process and reducing the likelihood of hospitalizations. So we started out with 2 different types. With this Regen was one, and then we had Etesmibab and combined with Bamlanimab. But now with all the variants out there, they have doubled up certain doses and combined different ones to make sure that we're covering for all the various variants. But it's so super important because I literally have COVID patients who are so sick in office that come in like day 2 or 3, they're feeling so much better, like a complete 360 degrees. And for each of those clients that I can prevent from getting hospitalized, that's the goal. We want less people that way. We want your body to be able to fight.
So tell the audience, just because I know how much, but how, within what time period? So once you get the symptoms, or whenever you get your first positive, like what time period should you be getting the
within 10 days of symptom onset.
Gotcha.
So let's say I feel sick today and I went to get my COVID test and it comes back in 3 days. You're still within that 10-day window. So the earlier in that window you can come in, the more likelihood that we can stop the viral replication in your body, right? So if you have a lot of virus in the body and you're stopping it from binding to and attaching to your receptor cells, it can't invade anymore, because here I have something scooping it up and transporting it out. And so if they can't find the host to invade, they can't replicate, and they can't keep making more and can't keep making you sick, and then having that overdriven immune response because you have so much of that just sitting there and invading and then causing all that inflammation and all the additional things. And so what people don't realize is that for how many millions of people in America are overweight or obese, that's an inflammatory process. That's a chronic inflammatory process, right? That's continually happening. So that increases your risk of being hospitalized, even if you have no other medical condition by itself. So that's why it was so important to make sure that it was a therapy that was available to everybody. So even though they had certain criterias, I would, as the provider, make my own assessment and look at the risk and say, all right, this person has already gone to the ER for dehydration and vomiting. And yes, maybe he's not overweight, but we're having patients who are without risk factors getting hospitalized. So you make the medical decisions. And then now they've even broadened out the criteria to include everybody, because they're realizing, like, look, even the people without risk factors were ended up in the hospital. So for me, I look at certain things and then I document in my medical notes the reason for my decision making and why, even though they weren't in criteria, why I decided to treat. And I've, from young to extremely old, have benefited from the monoclonal infusions to date.
I love it. I love it. I love it.
Yeah.
Now, you consult nurses who are wanting to be nurse practitioners. Now, why do you think that this is important?
Well, for me, there was a lot of learning on my own, trying to figure out the processes. A lot of money lost, right? To pay to learn. So if I had had somebody to mentor and show me certain things, I would not have lost money on certain things that you even pay for services for supposedly credible people. And then you realize they're not. And that's money down the drain. And then you have to start over and pay somebody new. So offering them a guide of somewhat, because look, if I can stop you from making all of those mistakes, that's more money in your pocket. You can get to your goal much quicker. Whether you're going independent or you're partnering up with somebody. We've done it before. I've spent countless hours creating a lot of my policies and procedures. There's no need to reinvent the wheel if people don't want to. Everything is duplicatable, right? That's right. I think that's important so that other NPs can know that it's possible. If this is your dream, if this is your vision, you can do it. The question remains is, how hard are you willing to work for it? And what are you willing to sacrifice for it? Right? Because some of us want it, but we don't want to do the work.
That's right.
And it doesn't go like that. There's been tons of late nights. There have been tons of hours just pouring into policies, going through the laws, make sure everything is in place so that we stay within our scope of practice and also be able to take care of our patients the way that they deserve to be taken care of.
Well, you are absolutely amazing. This has been a very fruitful conversation.
Yes.
It is just amazing. So we've just finished our VP Nursing Business Academy 4-day master class. It was such a phenomenal event. You still have time to sign up for VP Nursing Business Academy. The last day is July 5th, 2021. We can jump on a call so that you're able to gain clarity on how to create multiple streams of income. You can sign up at vpnursing.com. I'd ask that you like and share this podcast. Now, of course, we're here just being intentional about connecting you with leaders such as Shaima that have overcome, so that you know that the possibilities are endless. So you know that those possibilities are endless because Shaima came from Jamaica.
Yes.
The baby. Okay,
Yeah.
and worked it out. So you
Yes.
are amazing. So thank you, Shaman, for showing up.
Thank
And
you for
thank
having
you,
me.
everybody. Have a great rest of your day.
Yes.